Two patients can have the same serious illness, but one may qualify for hospice while other may not. Why? Because hospice eligibility is not based on the name of the disease. Today, let's look at a kidney disease example and understand what may make someone eligible or not yet eligible for hospice care. Hi, my name is Rupal. I'm a registered nurse with experience in hospice and palliative care, and I help families understand care options during serious illnesses. In the last few episodes, we talked about when hospice conversations should begin and how healthcare professionals can help families navigate those conversations. Today, we are going one step further. We will look at a real-life kidney disease scenario and understand why a patient may not qualify for hospice at one point, but may qualify later as the illness progresses and the goals of care change. This is one of the most confusing questions for patients, families, and even healthcare professionals. When is someone actually eligible for hospice? During a serious illness, patients often go through many different phases. There may be days when they seem to be doing better. Then there may be days when no matter how much everyone tries, the treatment does not seem to be helping enough. It can feel like taking one step forward and two steps backward. That is when families begin asking, is it time for hospice? Should we continue treatment? Are we giving up too soon? So the first scenario, imagine that you have been living with kidney disease for past 10 years. Your kidney disease developed after living with type 2 diabetes for many years. For a long time, the illness did not greatly affect your normal routine or your ability to work and enjoy life. Then, about a year ago, your doctor told you that your kidney function was getting worse. You had reached stage 4 kidney disease, and eventually you needed dialysis twice a week. This was serious. But you saw it as another challenge that you were prepared to face. You also had a very supportive family standing beside you. 6 months later, you are becoming more tired. Someone mentions hospice, so you and your family decide to request a consultation and learn more. However, you may not qualify for hospice at this time. You're still driving on the days when you do not have dialysis. You can complete most of your daily activities with very little help. You experience some shortness of breath, but your symptoms are manageable. Your kidney function has not changed significantly during the past 6 months. Most importantly, you want to continue dialysis because you hope to live long enough to attend your grandson's wedding. In this situation, the two major parts of hospice eligibility may not yet align. First, your doctors may not believe that your life expectancy is 6 months or less if the illness follows its normal course. Second, your personal goal is to continue life-prolonging treatment for your kidney disease. Your quality of life may not be where you want it to be, but that alone does not necessarily mean you're ready or eligible for hospice. At this stage, palliative care may be a better fit. Palliative care can help manage symptoms such as shortness of breath, fatigue, anxiety, and discomfort while you continue dialysis. Now, depending on your medical needs, home health services may also provide additional support. Now, let's see what happens as your illness progresses. Scenario 2. Another year passes. Your quality of life is no longer what it was 10 years ago, 1 year ago, or even 6 months ago. Fluid begins building up in your body more quickly. You become short of breath while walking, bathing, dressing, or completing other daily activities. You feel weaker and more exhausted. Because of the fluid buildup and worsening symptoms, your doctor recommends increasing dialysis from twice a week to 3 times a week. But returning home from dialysis is very different from returning home after a regular doctor's appointment. You spend 3 to 5 hours in that dialysis chair. When you return home, you're completely exhausted. For at least the rest of that day, you need help with activities you previously completed on your own. Your family begins helping with meals, bathing, dressing, medications, and other needs. They are not complaining, but your care is becoming a large part of their daily routine. After dialysis, you may feel a little better for a day or two, then it's already time for next treatment. This continues for weeks and then months. Your family members begin taking turns caring for you and taking you to the dialysis. Even with dialysis 3 times a week, fluid continues to build up. Your shortness of breath, fatigue, weakness, and dependence on others continue to increase. Dialysis does not seem to be helping the way it once did. You recognize this, your family recognizes it, your doctors recognizes it too. After discussing the situation with your family and healthcare team, you decide that you no longer want to continue dialysis. You do not want to return to the hospital. You want your remaining time to focus on comfort, dignity, and being at home with your family. You feel that you have lived a meaningful life and satisfying life, and you are ready to allow the illness to follow its natural course. Would it be appropriate to request another hospice evaluation now? Absolutely. Yes, this is a very appropriate time to contact hospice again. Your condition has declined. Your symptoms have become more difficult to manage. You need help with daily activities. Dialysis is no longer providing the benefit it once did. Your goals have also changed from prolonging life to receiving comfort, focused care at home. After dialysis is discontinued, the hospice physician and your attending physician, if you have one, will review your complete medical condition and determine whether your prognosis is 6 months or less and you qualify for hospice care. Based on this pattern of decline, you may now be much more likely to qualify for hospice care. But remember, the final decision is based on an individual medical evaluation. It is not based on one symptom, one lab result, or simply the decision to stop the treatment. The diagnosis alone does not determine hospice eligibility. Having kidney disease does not automatically mean someone qualifies for hospice. And continued dialysis does not automatically mean that hospice is impossible. So doctors look at the complete picture, the progression of the illness, the patient's overall decline, worsening symptoms, increased dependency on others, response to the treatment, expected prognosis, and most importantly, the patient's goals, your goals of care. In the first scenario, the patient wanted to continue dialysis, remained mostly independent, and did not appear to have a prognosis of 6 months or less. And we were right. Palliative care was likely the better fit. In second scenario, the patient had experienced significant decline. Treatment was providing less to no benefit, and the patient chose comfort-focused care instead of continuing dialysis and hospitalizations. That made another hospice consultation appropriate. This is only one example. In upcoming episodes, we will look at other common situations and discuss why a patient may or may not qualify for hospice care. Every patient is different, so families should not try to make this decision alone. Ask the treating physician, palliative care team, or hospice provider for an evaluation. A hospice consultation is an opportunity to receive information. It does not force the patient to enroll. If you have questions, please leave them in the comments. I will do my best to answer them. See you next time.